Sarwar Chaudhry, a pulmonologist. We're going to talk about wheezing today, what causes the wheezing and how we normally diagnose and treat the different conditions which may cause the wheezing. The wheezing is a whistle-like sound that comes out of the chest when someone breathes. It may have slightly different character in different individuals. It may be constant or it may be variable and happening at different times or on activity or exertion. The most common cause of wheezing is asthma, in which the airway get narrowed and cause difficulty in breathing air out, and that cause that whistle-like sound. In asthma, typically it is intermittent and associated with other symptoms of asthma such as cough, breathlessness, chest tightness, or pain. Other reasons of wheezing is in people who suffer from chronic obstructive pulmonary disease or COPD. COPD is chronic lung conditions caused by excessive smoke inhalation. There may be associated other findings of COPD in such patients. Another cause that we sometimes encounter, especially in association with asthma, is upper airway wheezing related to throat or vocal cord dysfunction. These patients generally experience wheezing coming from the throat area, and they may have other upper airway dysfunction symptoms. Now, talking about unusual causes of wheezing, it could be a foreign body inhalation, especially in a small child who develop new onset wheezing. We may see sometime, a piece of peanut has gone wrong way into the bronchi or airways, causing this trouble. In elderly people, it may be fixed wheezing due to a tumor growing in the airway or a polyp. And there may be again associated symptoms with that. So as we can see, there are many potential reasons for wheezing. So if you suffer from new wheezing or have associated respiratory symptoms, then they should be assessed by a qualified physician so that we can determine exactly the reason for wheezing and then treat that condition accordingly.